Hello everyone, Namaste and welcome to the third session of our NPTEL course on herbal drug technology. This week we are seeing the different type of interactions that the herbal drugs undergo. In the previous session we saw that your herbs that you consume for its therapeutic benefits can interact with other herbs, can interact with drugs, also can interact with foods to increase or decrease the effect of the consumed drug as well as of the herbal taken. Now, if you recollect, we saw the interaction of these herbs with the drug or the food or other herbs can be divided broadly into two categories. The very first category was your pharmacokinetic interaction. The kinetic interactions deal with absorption, distribution, metabolism and excretion. Basically it deals with what body does to the drug, and because we are consuming herb in addition to the drug, the body may accelerate its metabolism or de-accelerate its metabolism, leading to different changes. Those changes are counted in the pharmacokinetic parameters. The other category was your pharmacodynamic. Now in pharmacodynamic interactions, it is basically what your drug or a herb does to your body. This is more to do with the therapeutic benefits of your herb as well as drugs. So when you consume this drug along with other herb or food or other ingredients, the effect may be boosted, that is enhanced. In that case you can say it is additive, synergistic, potentiated. So they differ in a very little way, saying additive is just 1 plus 1, so both of them add to their effect. Synergistic is more than additive, that is more than the effect desired, and potentiation is when your herb per se doesn't have that therapeutic benefit, but because when you're consuming it with another drug, now it is suddenly giving you more than additive effect, but for a drug which doesn't have that therapeutic, that is called as potentiating. So me consuming black pepper will potentiate some other therapeutic activity which the black pepper doesn't owe to, and that is what I define as potentiation. Whereas in some cases the effects may be negative. Now these negative effects are often referred to as antagonistic, that is they nullify each other, or depending upon which is more stronger contender, the effect goes on a positive side or the effect goes on the adverse side. In some cases even adverse or unprecedented effects may be seen. Now in this particular session we will be dealing with two examples of herb interactions with drugs, and the cases are Hypericum and Ginseng. So let's start with Hypericum as a case study. Now Hypericum is a herbal supplement which is available over the counter. That is a need to worry, because something that is available over the counter need not be prescribed and people at large can just take it or buy it. So this is a herb which is obtained from a plant called as St. John's wort, often botanically referred to as Hypericum perforatum, and it's belonging to the family Hyperaceae, or often referred to as Guttiferaceae. Now this is in local language referred to as klamath weed or tryptin or even a goat weed. It's marked by a nice star yellow color flowers, and the aerial parts of this plant are often sold in powder as a supplement. Now this supplement people often administer for numerous therapeutic benefits, the most common one being as antidepressant. So the reason why this herb is selling fast over the counter is its effect on depression and anxiety. But if you see traditionally this herb has been used as diuretic. It has been used for its wound healing activity. It has been used or advocated in menstrual disorders. It is used in treatment of intestinal infestations, worms, or even treatment of snake bites. cuts or even burns. Now, reports or few more research on this herb has led to following conclusions that Hypericum not only can be used here, it can also be used in treatment or at least management of cancers or inflammation related disorders, infections, particularly bacterial and viral infections, antioxidant as also neuroprotective. Now, apart from neuroprotective, like I said, the reason why it is prescribed or taken is mostly for depression and management of mood. Now, if you see what exactly in this Hypericum herb gives this activity is basically there are two classes of phytoconstituents which are present in Hypericum which are responsible for the activity. The very first class, what we refer to, is called as naphthodianthrones. So if you see naphtho, you can see here there is a naphthalene ring. So this naphthalene ring is surrounded by 1 and 2. So here you have like 1, 2, 3, 1, 2, 3. So two anthraquinones or two anthrones are kind of stuck to each other via a naphthalene ring formation in the center, and hence this category of phytoconstituents are called or are referred to as naphtodianthrones. Now this naphtodianthrones, especially hypericin, is something which people advocate or is thought of to produce this effects. In addition to that, it has other compounds which belong to this class. This includes your pseudohypericin, protohypericin and proto-pseudohypericin. So all of this combined together form the naphtodianthrones. Now recently lot of research has gone into it. Hypericin was something which was initially thought. Later on when research was done on it, it was found that more than hypericin, the next class of compounds called as the fluoroglucinols are responsible for the CNS effects especially. The reason is they are extensively lipophilic. So if you see, you can see here a phenyl with 3 oxygens typically representing a fluoroglucinol nucleus, and to that you have numerous isoprenoids like C5 joined. So you have numerous C5 joined to each other, and this makes this molecule extensively lipophilic. Now in this category you have your hyperforin, which is thought to be very much potent. You have your adhyperforin, hyperferrin and adhyperferrin. So this compounds altogether, in addition to your naphtodianthrones, are responsible for the CNS activity, and more research reports that fluoroglucinols are much more potent than your naphtodianthrones. But there's a problem. The problem is, if you see your hyperforin is unstable to light. So it undergoes a kind of rearrangement and is easily oxidized. So much so that, if you take your dry herb and just expose it in the sunlight for just a period of 2 hours. Imagine just cutting the plant and keeping the plant exposed to a bright sunlight. So after it is being cut off, it is observed that this hyperforin starts to deteriorate. And if you take the compound and expose it per se, this pure compound undergoes as high as 20% deterioration in presence of sunlight. Now in addition to that, the antioxidant potency of your Hypericum is also attributed to the flavonoids hyperoside and rutin. Now coming to the applications or pharmacological activity. The pharmacological activity of hypericin is, like I said, because of your hypericin and hyperforin. So the pharmacological, especially the antidepressant activity of Hypericum or St. John's wort, is attributed to these two compounds, that is your hypericin and hyperforin. Now what do they do is, if you see your what is called as synaptic cleft. So here you have your neuron and that is passing the message to another neuron. So this is what you call it as a synapse. So a signal has to pass from here to here. Now in between there is a gap. Now that's what is called as your junction. So what happens is, here all your neurotransmitters are there in form of vesicles, and slowly because of the action of ion channels, they are released in the synapse. So imagine your serotonin, your dopamine, your non-adrenaline, GABA, all of them are released, and the next neuron has a receptor. So what is going to happen is, this neurotransmitters are going to bind to the receptors and thereupon exhibit its transmission. Now since the number of receptors are limited, a number of neurotransmitters are moving freely, waiting for their turn in this synaptic junction. Now as the function of the synapse is to transmit, once the signal is transmitted, what happens, this excess of neurotransmitters are then taken back. Okay, we call it as reuptake. So reuptake of this neurotransmitters happen back to what is called as the presynapse. And then what is going to happen is, all these neurotransmitters are taken back and again the synapse become clear till you get the next signal. Now imagine what happens if this reuptake is inhibited. If this reuptake is inhibited, it is going to remain in the synapse for a longer duration of time, and the neuronal transmission will happen for more period of time. So hyperfolin and hypericin majorly act by inhibiting the uptake of the neurotransmitters. So they inhibit the uptake of 5-HT, dopamine, non-adrenaline, GABA, L-glutamate, that's your hyperfolin, whereas hypericin is known to inhibit the reuptake of serotonin, norepinephrine, dopamine, that increases their level in the synaptic junction. Apart from that, what also happens is, these neurotransmitters are basically like amine containing. I'm just roughly drawing it. So this amino group is very vital. Now monoamine, you have what is called as monoamine oxidase. Now monoamine oxidase is an enzyme which is going to remove the amine group from this neurotransmitters. Now once this amine group is removed from your neurotransmitters are rendered inactive and they are inefficient. So what is happening is, apart from your reuptake inhibition, hypericin is also inhibiting the enzyme that breaks the amine or removes the amine. So again you have amine which is going to be there for a longer duration of time, and hence your gap function is overall improved. So that is how they work. Now this can interact with drugs and lead to what are called as herb drug interactions. So one classic case is pharmacokinetic interactions. Now pharmacokinetic interactions, if you recollect, exhibit or are exhibited by changes in ADME. Now whenever a drug is in your body, it has to go to certain ADME processes. This includes your absorption, metabolism, distribution and excretion. Now in that, we saw in the previous session that cytochrome enzymes play a vital role in drug metabolism. So our body doesn't want this drug molecules, it wants to get rid of it. So I have my drug molecule, this drug molecule will be acted upon by enzyme and then it would be converted into an inactive drug or inactive molecule. Now this enzymes many a time are your cytochromes. Now this cytochromes help in inactivation of drug and thereby help in eliminating it. We saw it, they are involved in phase 1 transformations. So if you see CYP, or that is cytochrome P450, in that there is a subclass called as cytochrome 3A4, which is responsible for metabolizing almost 50% of the marketed drugs. Now these drugs include your statins, example is your simvastatin, which is responsible for your maintenance of blood pressure. People take it to decrease their BP. immunosuppressants, especially for patients those who have any transplants. Then you have calcium channel blockers, which are taken by heart patient those who have CVS disorders, and this includes your nifedipine, amlodipine, and certain antibiotics. So these are all substrates of your this enzyme. Now imagine what this hypericum does is, this hypericum inactivates the CYP3A4. So as a result, this reaction is also stopped, and what is going to happen is your concentration of drug in the blood increases because its metabolism is stopped, and as a result enhanced level of this drugs can cause lot of side effects. So this is one way. Second, hypericum also is known to somewhere interact with P-glycoprotein as well. So it is said that St. John wort increases the activity of P-glycoprotein in gut. So what happens is, say for example, this is your intestine, okay, and your drug molecules are in here. So this drug molecules want to get absorbed through your gut. Now as they are getting absorbed, what this P-glycoprotein does is, P-glycoprotein senses that this is not a favorable molecule, this is a foreign molecule and I want to get rid of it. So P-glycoprotein kind of pushes it out again. So the more the P-glycoproteins, the way it is pushed back into the gut. So imagine St. John wort increases the activity of P-glycoprotein. So what will happen? Majority of the drug that is absorbed again gets pushed back into drug, and therefore the amount of drug in your bloodstream decreases. Now if it is decreases, that reduces the overall effect of this drugs. Now which are these drugs which get absorbed or which get really thrown out by P-glycoprotein? So the following examples of P-glycoprotein include anti-cancer drugs such as vincristine, vinblastine, paclitaxel, docetaxel, or even doxorubicin. Your HIV, anti-HIV drugs which includes your saquinavir, ritonavir, also a drug loperamide which is given for diarrhea. This is not your HIV protease, this is your antidiarrheal drug. Then you have your cardiac drugs such as your digoxin, you have your immunosuppressants such as cyclosporin and FK molecule 506, as well as calcium channel blockers such as verapamil. So you can even see more of this interactions. Last time I had shown you how to use the drug bank, so I have kept this link out here. So you can click on this link, you will get numerous interactions, both pharmacokinetic as well as pharmacodynamic interaction. So right now we saw the cytochrome P40, we saw the P-glycoprotein. Now let's see the pharmacodynamic interactions. Now we saw that St. John wort kind of increases the residence time of neurotransmitters in your synaptic junction. Now if this residence time is increased, there are certain drugs which also do the same thing, and these drugs are selective serotonin reuptake inhibitors. Now many drugs which are given in depression, they are your serotonin reuptake inhibitors, because serotonin is one of endogenous molecule which makes you happy. That means that molecule need to be there in your brain for a longer duration of time. So imagine you are taking drugs to keep this serotonin in your junction. So my serotonin is kept here for a longer duration of time, keeping my patient happy away from depression. So there are selective serotonin reuptake inhibitors such as your sertraline, your paroxetine, you have your other drugs such as fluoxetine. Now imagine this is also doing the same thing, and hypericum is also doing the same thing. What is happening is the amount of serotonin in your synaptic cleft or in this gap is going to increase. Now this increase beyond a particular level is also not good and leads to what is called as serotonin syndrome. Now this serotonin syndrome can just lead to mild dizziness initially, but as the concentration increases is responsible for even increasing your heartbeat, increasing your blood pressure, giving you kind of a seizure like symptoms, tremors or even fevers. So excessive serotonin, which is caused by addition of this Hypericum plus SSRI, that is your selective serotonin reuptake inhibitors, is going to be bad. Now it also says that you have to check the other drugs. Now not necessarily antidepressant, but there are other drugs which the side effect is somewhere inhibition of uptake of neurotransmitters. So this side effect of other drugs may be added with Hypericum and it will produce a potential activity or unpredictable outcomes. So again I have put in a link here, you can see drugs.com, where you can see more of such kind of interactions. Now going to the next drug is ginseng. Do you recollect where you see this drug in your day-to-day prescriptions? If any of you have taken a supplement called as Revital, Revital is one of a supplement which uses ginseng. So ginseng is actually a traditional Chinese remedy, again available over the counter, and it is derived majoritarily globally from two main sources, that is Panax ginseng and Panax quinquefolius. The Panax ginseng comes majority from the Asian subcontinent, whereas quinquefolius comes majority from the American continent. Apart from that, there are few other ginseng varieties, species, which include your Japanese ginseng, that is your Panax japonicus, your South Chinese ginseng, that is your Panax noto ginseng, and the Vietnamese ginseng called as your Panax vietnamensis. Now they all are Araliaceae family members. They are a short stout herb, and ginseng is commonly administered to boost your immunity, to boost your memory, stamina, cognition, to manage stress. In men, people take it for the erectile dysfunction, and some of the effect of ginseng also includes your blood sugar control. So all in all, this is more a kind of a rejuvenating herb which is taken again over the counter. If you see the phytochemical part of it, what exactly are the actives of it? The phytoconstituents of ginseng are majorly classified into two categories. The first one, which are saponins, that is steroidal glycosides as well as triterpenoidal glycosides. The other ones being non-saponins like the flavonoids, tannins and phenolics. The action of ginseng is due to the saponins, and so far almost 280 and still counting ginsenosides have been reported from these plants. Now interestingly, so many ginsenosides were present. Now you can get almost 200. It was difficult to name them. So they have an interesting nomenclature. So you can classify them based on their nucleus. So the nucleus includes the most common damarine type, that is the steroidal type. So you have your 4 rings, of which the 4th ring or the D ring is a 5-membered ring, and then you have a aliphatic open chain attachment which is done to the carbon 17 of the steroidal moiety. Now depending upon the number of alcohols in the steroidal ring, here you have your 2 alcohols, and that is the reason it is called as protopanexodiol. And here in this case you have 3 alcohols. You have your 1, you have your 2, which is same. The third one is additionally out here, and that is the reason it is called as protopanexotriol. So you have damarine type, in which you have your protopanexodiol, protopanexotriol. You have your oleane type, which is more of a pentacyclic member, and then you have your ocotolol type, which has, in addition to here, you might find a furan ring joint to here. The example of ocotolol type includes your pseudo ginsenoside F11 and F12. Oleane type includes your RO. Now what are all this R? You will see. So initially when ginsenoside was being characterized for the compounds, numerous compounds which were very similar were found. Now you come to know they are very same in structure, and as a result they were divided based on the TLC. Something as simple as a TLC. So compounds with a very low RF were called as RA, then you had your RB, RC, RD and so on. So depending upon the RF the series went on, okay, and in that you had the sub classification. So RA1, 2, 3. So when I say RA, it's going to be the polarmost compound. When I say it is going to be RG, you can see it is going towards a more non-polar category. So these are the classification based on their polarity. Now coming to the types of ginseng that are available in market, based on the processing we have white ginseng. This is the simplest type. So what is done is the ginseng is kind of uprooted and dried in the sun. The advantage is this has the highest amount of polar ginsenosides. Now this is processed to get what is called as red ginseng, which is called as a steamed ginseng, and it is steamed at about 100 degrees Celsius. That is the steam temperature, and what happens is because of steaming you get more of what is called as RG3. Now black ginseng is thought as to be a very commercial ginseng or Korean ginseng. This undergoes repeated cycle of autoclaving, drying, so much so that it becomes caramelized and black, and that is the reason it is thought to be therapeutically more active. It is said it is to have a higher content of polyphenols and is enhanced in RG3, 5 and RK1. Now a little modification of that is, apart from steaming, a shorter or much easier faster way is why don't we autoclave it, and that is done in case of sun ginseng. So this ginseng is taken directly autoclaved and heated, and you will see that all in all you will get a similar RG5 and RG3 coming out at a higher concentration. Now in addition to that you also get fermented ginseng, where during the fermentations microbes produce an additional compound called as compound K from your ginsenosides RB1 and RB2. And then you have chemically processed ginseng. This ginseng are mostly saponins, they contain numerous sugars. So when you do acid hydrolysis, you will have removed those sugars and you get more of the non-polar derivatives, and that's what is called as chemically processed. So these are different variants of ginseng in the market. Coming to the pharmacological activities, the antioxidant, the neuroprotective, rejuvenating activities of ginseng are contributed mostly by binding to membrane bound ion channels, cell membranes, and most of the receptors that cause alterations in the transcription level. Not only that, the ginsenosides are known to decrease the free radicals, that is the serum ROS, as well as methane decarboxylic aldehyde, which is responsible for the stress conditions. Now in addition to that, the anti-inflammatory activities are attributed to decrease in levels or suppression of NF-kappa B, as well as what is called as the lipopolysaccharide induced tumor necrosis factor TNF alpha, as well as interleukin 6. Not only that, it also selectively inhibits cyclooxygenase enzyme 2 and shows your anti-inflammatory activity. Now ginseng is also known to interact. So let's first focus on the pharmacokinetic interaction. It induces cytochrome. So we saw drugs, then you had your cytochromes, and then you had the inactive metabolite. Again, if cytochromes are inhibited, you will have a stronger drug concentration. So again, it is seen to be a inducer of CYP4A that will lead to higher concentrations of drug, and this includes your different drugs which we saw previously. Now in addition to that, it shows a little weak interaction even with P-glycoproteins. Now, one particular interaction which is a case study is seen with red ginseng. So, if you see fermented red ginseng, it induces P-glycoprotein, and so much so that if you take a like antihistaminic or anti-allergic drug like fexofenadine, the red fermented ginseng increase the fexofenadine concentration, which is commonly referred to as Arianda curve. That's nothing but the concentration of fexofenadine in blood by as high as 32%. Now, this effect is seen only with the fermented variant and not with the unfermented variant. So, you can see that the sugars in the ginsenosides do play an important role here. Now, again, in addition to that, if you specifically think about CYP4A, one particular interaction which is very marked for ginseng is that with midazolam. Now, midazolam is again a sedative anti-anxiety drug given, and because of CYP3/4A inhibition, what is going to happen is the concentration of midazolam in blood increases, leading to higher levels or higher concentrations and higher sedation. Now, going to the pharmacodynamic interactions, it is seen that ginseng also shows pharmacodynamic interaction mostly with the opioid drugs. So, people, especially those who consume ginseng, and when they take opioid drug, it is seen that their effect is reduced. Now, the exact mechanism is not clearly understood, but the analgesic effect of opioid analgesics is reduced when you consume ginseng. Not only that, we just discussed ginseng was something which was administered to control sugar. Now, this effect is not seen in healthy individuals, but if a diabetic patient is taking medications, especially anti-diabetic drugs, it is seen that ginseng in this case also reduces sugar. And imagine you consuming metformin or drugs which are also kind of reducing sugar, that will lead to an increased risk of hypoglycemia. So, the overall blood glucose level drastically go down, and you need to be careful while consuming ginseng, especially if you are on anti-diabetic drugs. Similarly, we just discussed monoamine oxidase inhibitors. Now, if you see, ginseng also works via inhibition of uptake of neurotransmitters. So, it also interacts with MAO inhibitors, that is monoamine inhibitors class, particularly phenelazine and selegiline. And what happens is, if you take them in an increased concentration, this increased concentration of MAO inhibitors or this increased concentration of drug can cause headache, tremors, agitation, and even in some cases maniac episodes. So, you need to be careful as it may lead to overall higher stimulant effect than anticipated. So, here are a few references which can give you still more additional interactions about your Hypericum and ginseng, and thank you everyone for your patient listening.